One. Hi, Tanya. How are you doing?
Hi, sir. I'm good. Thank you.
So in our last session, if you remember, we have covered the basics of E&M, in which what all topics we have covered, do you remember? That is history, physical examination, MDM, right? So we have learned those sections in our last session. Now today, our objective is to learn about more specificity related to E&M. Let's see, I will share with you my screen. I hope you can see my screen.
Yes.
Okay, so let's see today our purpose, what we are going to discuss is there are two things which we will learn today. One is about how there are different ways by which you can get the CPT code, E&M CPT code. There are two ways, right? That we will discuss today. Another one is, as you already know, that there are three steps we have discussed in MDM. That is problem point, data point, risk. Am I correct?
Yes.
Yes. So now what we are going to do today, we will go a little slowly, and I want you to practice so that once you start practicing, then you can understand the basics of E&M and you are able to get appropriate CPT code. So let's talk about first thing, that is there are two ways by which you can get the CPT code in outpatient as well as in inpatient. I hope you understand the meaning of outpatient, inpatient, right? So outpatient is where you see that the patient visits the doctor and they take the service and they go back in the same day, whereas inpatient is the service where patient got admitted in hospital and they stay in the hospital for a few days to get appropriate services. I hope you understand the difference between outpatient and inpatient. So there are two ways by which we can get the CPT code. That is, one is with the help of medical decision making, and another method is based on time, right? So today we are going to focus towards medical decision making. As you already know, we have discussed this earlier that in under MDM we have problem point, data point, risk. So let's see, I will show you now. We'll discuss. Okay, can you see this MDM grid? There are three grids. Are you able to see, Tanya? The MDM grid. Can you see that? Yes. So there are three MDM grids you can see. We have a number and complexity of problem. So many people call it as table A, table B, and table C. Some people call it as problem point, data point, risk. And nowadays, when you go for any interview, they will ask you this question: what do you mean by problem point? Nowadays, people don't use the term problem point; they use the term COPA. That is complexity of problem addressed. Can you see this? Here they have the number and complexity of problem addressed. So I'm trying to simplify this concept of COPA. But remember, with the calculation of problem point, that is COPA, data point, and risk, we will get a appropriate CPT code, right? Can you see that? At the extreme left, you can see the codes here. So based on the calculation of all the three, we will get a particular CPT code. So this is what our objective is now. So first, we will start with the problem point, that is COPA, right? You understand, Tanya?
Yes.
Okay, now we will talk about, let's see, problem point. As I already told you, problem point is also called as COPA. What is the full form of problem point, COPA? I'm sorry, COPA. If you see here, it says complexity of problem addressed. See, the term itself will explain you complexity of problem addressed, right? When you say complexity of problem addressed, it means that, what do you mean by problem? The one which the diagnosis, right? Problems are diagnosis, and complexity means the severity of the diagnosis, and those diagnoses needs to be addressed. So today, now what I have done, I have split this COPA into 4 steps. Can you see those 4 steps? Are you able to see,
Yes.
Tanya?
Yes, sir.
Yeah, so if you see here, total number of diagnosis under assessment and plan, total number of diagnosis addressed, nature of address problem, and level of problem point. So as you see, there are, I told you, like we have COPA, we have data point, we have risk. So there are 3 levels. We will get a problem point level, we will get a data point level, and we will get a risk level. So now our objective is to calculate all the 4 and get the problem point level. This is what our objective is. So first thing we will learn, total number of diagnosis under assessment and plan. What is the meaning of this? This is what we are going to learn today. And in the next session, we will talk about total number of diagnosis addressed, and then nature of address problem, and then I will teach you how do we calculate the level of problem point, right? So let's talk about now the first step of COPA, that is total number of diagnosis under assessment and plan, right? So what do you mean by diagnosis? I see I have given you the definition of diagnosis. Diagnosis, first of all, I told you that diagnosis means except Z codes and integral symptoms, all conditions we can count as a diagnosis. Is it clear to you, Tanya? Do you understand that you should not
Yes,
count
sir.
Z codes
Yeah.
and you should not consider the integral symptoms. Rest of the conditions you can count them as number of diagnosis, which is documented under assessment and plan. Now, many times, Tanya, what happened that people don't understand, they take diagnosis from anywhere in the note, but as per the 2026 concept, it has explained us that history and physical examination, from there we do not take diagnosis. We take diagnosis only from assessment and plan. So you can see here, we can see, if I've written a note here, we say that under MDM section, you can get this assessment and plan. And some doctors use the term assessment and plan, some doctors use the impression and diagnosis kind of words. I hope it is clear. Any questions, Tanya?
No,
Tanya,
sir.
can you hear me? Yeah. So if you see here, we have discussed that. Remember this point that diagnosis, you cannot count Z codes and you cannot count integral symptoms. And diagnosis, you need to take only from which area? Tanya, can you help me? You need to take it from history and physical examination, or you need to take only from assessment and plan?
Only from assessment and plan.
Absolutely correct. So I will give you one example now. We'll do it together, and then you need to do another chart, which I will give you after this. So let's see assessment and plan. So how many conditions can you see here, Tanya? Can you count the number of diagnoses under this? Total number of diagnoses, how many of them are there under assessment and plan? Can you count, please?
Only one.
Yeah. Why you have said only one? Because if you see here, history of pneumonia is a Z code. So you have followed the instructions very carefully. You said it's only one because history of pneumonia is a Z code and polydipsia is an integral symptom of diabetes. Am I correct? This is the reason you said one?
Yes.
Absolutely correct. So you are following the concept in a appropriate manner. So now I will show you another chart. Yeah, this is a complete chart. So as an E&M coder, you should know how to read the note. So first thing you should check, Tanya, are you able to see the screen, Tanya? Is it visible to you? Is it there?
Yes.
Okay. So when you see here chart, under the chart, if you see, we have history section, we have physical examinations, and we have assessment and plan. And then you need to see signature. If you see, all the four things must be there in each and every E&M note. If it is there, then it indicates you that the chart is complete. Do you understand? So whenever you do E&M, you need to check history, you need to check physical examination, you must have assessment and plan, and you must have signature of the physician who has given the service. With this, you will understand that, okay, this is what my complete note looks like. So now many people, they directly jump to assessment and plan and start counting the diagnosis. You should not do that. You should read the entire note right from the details of a patient and demographic details, that is details of a patient. And you see here, what is the chief complaint, Tanya, here? Can you see that? What is the chief complaint? Abdominal pain, right?
Yes.
So now if you see abdominal pain from last 4 days, pain scale 9 by 10, fever, ROS, no, abdominal pain is there, yes, past history. You should read everything. You should understand what is the complexity. You will get a lot of details here. History and physical examination is a great tool. We will discuss in detail in our next session. And if you see gastrointestinal, they have in physical examination, right upper quadrant tenderness is there. And under assessment, doctor has mentioned two conditions. So Tanya, can you help me? How many diagnoses are there under assessment and plan?
Only one diagnosis, that is
Yeah, only one.
cirrhosis.
Why do you think only one? What is the reason? Can you explain me that, Tanya?
Because they've mentioned right upper quadrant pain, and that is the integral symptom of cirrhosis.
Absolutely correct. You are absolutely correct. That's the reason you have only one problem under assessment and plan. This is what we call the total number of diagnosis. So total number of diagnosis is one, right? So the way you are doing, Tanya, it's really good. You need to keep doing this. I will give you more examples like this so that you can practice such charts, such scenarios, right? Do you have any questions?
No, sir, I don't have.
Okay, thank you very much to attend this session, Tanya. In the next session, we will discuss more about total number of diagnosis, address, right, nature of problem, and then the level of problem point. So all these calculations will help us to get the level of problem point. So you need to be good in all these sections. I will give you more examples like this, and keep practicing it, right? Thank you very much, Tanya. Nice talking to you.
Thank you, sir.